On to all the other topics, prevention and management. Okay, and so we've had a lot of we've had a very interesting conversation about STI and early detection, treatment, communicating the status, which we agreed was one of the toughest parts as well, right?
Yes.
And now we want to talk about prevention. How do we don't even want these things, okay? We don't want problem, okay? We don't want to have to start having sit-down talks and bring in a pastor and ensure that someone doesn't unleash fury on anyone, okay? How do we prevent? And then after we're done talking about prevention, we can now go on to management. So how do we even prevent all this? Trypanosomiasis, trichosome. What are all those, Dr. Ofem? All those strange names. Human papilloma virus, human immunodeficiency. How do we just prevent all of this?
We've talked about it before. Protect yourself.
How? You just say want to go and cover my sins and my body with the blood. Sprinkle olive oil and say, I'm fortified. I hereby going.
For the singles, if you tell them abstain, they will not listen. It's when you tell
I will listen. Tell me.
When you're married. The best form of prevention, actually, for those that are not yet married, is to abstain.
Oh.
That is the best form.
Are you guys hearing it? Abstain.
There's no fear whatsoever whether you have this, because you did nothing. Now it's difficult for people to listen to that. So protect yourself. Use condoms for the males. There are also female condoms, and I'm quite sure a lot of women, ladies, they're not aware. If I ask a guy different brands of condom, they'll tell me like 5 to 10.
Even the ones with color, the ones with flavor, the ones that
different
glow
sizes.
In the dark. The sizes.
Now, if you ask a lady, mention 3 brands of condom. Do you know? You have to think.
Durex.
Duracell.
Oh my god. Oh my god. No, I don't. But there's Durex. There's one that starts with D. Dr. Tade, help me.
Female condoms.
Oh, female condoms. Yes. They come in different brands.
I don't know. Okay, I just know we call them femidoms or femdoms or something. Femidoms.
So a lot of persons are not aware of that. So if you know, maybe you don't trust your partner, because there are persons that if you tell them protect yourself, they say, no, I like skin to skin.
Oh.
So
skin to skin.
So if you know you're that kind of person and you don't want to treat yourself, just get a condom.
Okay.
So if you can't get for your man, get for yourself.
You just Google female condoms. Don't type Duracell.
Yes.
Just type.
It's bring out lots of brand names.
All
you
the brands.
Ask, yes, then pharmacies will have it. I know it's not popular, but a lot of women feel condoms are just for guys.
Okay.
So if you can protect yourself, it will help a lot.
Okay. Protect yourself. Thank you very much. Dr. Owoeye, do you want to speak?
Yeah, I quite agree with her then, but I actually think prevention starts from awareness. I mean, we don't do too much in the area of awareness because, I mean, everything you do, everything that informs your health behavior starts from what you know.
Great.
So it starts from that point. Awareness is the first thing. Then, of course, from there, you can actually now say, okay, whatever it is you want to do, protect yourself. Knowing your status is also a way of actually preventing, because you need to know your status first. Okay. Yeah, awareness, knowing your status. If you're negative, then you know you have to do all that is possible, all that you can to remain negative. Okay. And that's where protection, abstinence, or whatever it is comes in. And then if you're positive, then you have to, treat yourself, things like that. So I actually think basically whatever it is you will do revolves around your awareness, knowing your status, and then, every other thing.
Oh, that's good. Dr. Tade, do you want to talk about this?
I think all the
you were laughing at me when I said Duracell. name 5 male condoms.
I don't think I would.
Okay, name 2.
Well, you said Durex.
Mm-hmm. Uh-huh.
This.
So
this
he
is
doesn't use
condom.
That's what it means.
For younger people.
What are you ratio of days?
I mean, for real, I think it's, that's probably something for, because I would just
Gold Circle.
Right, that's well, it's still around, Sha.
It's still like, oh, you even know the ones that are obsolete. Okay. So what do you think about prevention?
Well, I think they've pretty much, they haven't left any stone unturned. How do you prevent? You need to be aware, what are you preventing, right? And what is how much knowledge do you have about what you're trying to prevent? And what steps can you take? Who do you get that kind of information from?
Okay.
I think over the years, there's been a lot of awareness about STIs. But the one that is still not so popular, female condoms.
Exactly.
Because condoms are maybe just about the main, means of preventing, right, sexually transmitted infections. So, I mean, they're just a form of mechanical barrier.
Okay.
And you want to know enough.
Okay.
Right. So, I think, for some people who have like personal preferences, they want skin to skin. There are condoms that actually can make you feel like you're having skin to skin.
Oh, they are?
Yeah.
And you know them.
Because
he's making he's acting like he only knows one type, Durex. That's good. That's good to know. So which means there's a lot of more like production industrial effort to ensure that people still have fun while protecting.
Exactly.
How about we explore that?
Yeah.
I mean, then can we even talk about mother to child? Because that's another way, because there are also pregnant people who have certain kinds of infection, and you also want to make sure that you protect your child. Is it okay to breastfeed, or for lactating mothers, mother to child infection and all that? Dr. Owoeye, can you shed more light briefly on this?
Okay, vertical transmission, mother to child transmission. Usually this comes to play, it's a very, very important thing in when you're dealing with sexually transmitted infection.
Okay.
Both the bacterial infections and then the viral infections. I know most people, when they hear mother to child, they're thinking HIV, of course.
Yeah, right?
Yeah, exactly.
That's true.
Yeah, so gonorrhea can be passed from mother to child and can cause blindness in the child, because some of the complications you can get from mother to child. Yes, from mother to child transmission. So it's not just same thing with syphilis, can lead to some congenital malformations in the child if it's not well managed. So when you want to prevent mother to child transmission, the focus basically is the mother, because you know that the point where the maternal blood and then the fetal blood exchanges as at the placenta. So you actually want to prevent transplacental transfer, and then you also want to prevent, infection during delivery, because of course there's a whole lot of blood, and all that, going on. So if you're dealing with viruses, you want to reduce the viral load. A lot of times when we're dealing with HIV patients, you want the mother to be virally suppressed, because in that way, she's not likely to transmit, the infection to the child if she's virally suppressed. So these are the things. Even hepatitis B, you do the same thing. Then if you're dealing with a viral infection, you want to make sure that the mother is cleared, she's cured, before she gets pregnant.
So which means
or if she gets infection during pregnancy, you also want to make sure that you treat it well. Because, these are some of the things you want to do.
I think this is very, very important. I feel like we should just reemphasize it.
Okay.
Because when we talk about mother to child, I mean, that picture has HIV written all over it. Because everybody thinks, the only thing you can move on from a mother to the child is HIV. But it's interesting because, I mean, I just had blindness and I'm like thinking, do every woman know this? Because nobody wants a blind child, right? And nobody wants to intentionally birth a child. I mean, you can wait. You can wait 6 more months to get yourself free and clear to be able to birth a healthy child. Because at the end of the day, if that child comes out and has other health issues, you're going to be psychologically, emotionally, financially drained. And this is something that could have easily been avoided by getting yourself treated in the first instance. So it's important to note that mother to child infection does not stop with HIV. You have to be rid of most of these things before, thinking of getting pregnant, which is very important. And then let's quickly talk about how to manage, very quickly, management.
That would be management of
STIs, yeah.
Okay, so, well, the first step is to identify it. Right?
Okay.
You want to know, you want to test.
Okay.
And there's a lot of tests out there for different sexually transmitted infections, bacterial. So a lot of tests, some tests are blood-based, some are swab-based. That is, samples taken from the urethra, or that is urethra opening, or the vagina.
Yeah.
And then for like bacterial infections, you don't want to wait until your results are out, right?
Okay.
You need to explain your symptoms to a health professional, right? A medical doctor.
Okay.
They'll have a primary understanding of what could be wrong, right? And with that, they could place you on treatment before your results are out. Because some of those results take a bit, especially the culture results that could take up to 3 days. You won't be on treatment for away for those days.
Okay.
And in addition to that, you want to ensure that your partner, right, the status of your partner is also known. Do they have the same thing? Do they have symptoms as well?
Okay.
Even if they don't have symptoms, they still have to test.
Okay.
Right. And when they test, they also, very likely have to be on treatment as well.
That's great. Dr. Owoeye, do you want to weigh in on this?
Oh, well, it's pretty much, said it all. For treatments, he has already talked about identifying, whatever it is you have and treating adequately. It's very, very important. And I must stress here. And I think I'm not sure any doctor would tell you to stop taking your medications after symptoms disappear. For every disease you treat, there is a minimum, amount of dosage for the minimum amount of number of days that you must take them for. So it's important that people adhere strictly to whatever their doctors tell them to do. There are some medications for sexually transmitted infections that you have to take you throughout life, like HIV. You understand? You have to take it throughout life. And then sometimes I have patients exclaiming that throughout, and I tell them it's not only HIV that you have to treat throughout life. I mean, if
there's diabetes,
if you're diabetic, if you're hypertensive, if you're a sickle cell patient, these are things that of course. So, and for me, it's so convenient. It's just once a day dosing, and then you can actually pretty much go about your So what I'm trying to say is, whatever it is your physician is telling you to do, you must do it. And I always tell patients that you're the best kind of doctor for yourself. You should be well aware of your own body. You understand? And then even while on the treatment, if you notice, some very funny things, maybe funny reactions to the medication you're taking or something, you can always go back to your doctor and then, speak with them. Because sometimes these things, make patients not to comply. And then by the time they are now coming back and then you're seeing that, you're not actually getting better, they will now start telling you, when I started this medication, I started feeling this way and I decided to stop. People should,
Dr. Fem, do you want to quickly add something?
To add to that, there is also availability of vaccines
for
some of those STDs, STIs. So for hepatitis B and your HPV, the vaccine. So it will help a whole lot if you can get those vaccines to be able to prevent them. And then for the management, I'd advise you strictly adhere to the doctor's instructions. It's not right to say, okay, I felt this way before and they gave me this drug. Let me go back to the pharmacy, save yourself a lot of stress. Because most of these symptoms, they are similar.
Yeah.
So you have to, each time, always consult a doctor. Do testing to be sure what kind of STI is causing this symptom.
Because sometimes people are used to certain STIs. So like, I'm having a headache. Don't worry. This one is hepatitis B now that is doing me. Mix hepatitis B medicine. Assuming now that it was headache and dizziness, I'd have asked you to mix the one for herpes. But this one that is doing me now is typhoid and hepatitis B. Mix it. And then they will mix. And then there's something I want to add to management. People, there's also the psychological management. Okay. Yeah. When you are your mental state about this is something that we should also talk about, because there's this stigma. If you're not careful, even self-imposed stigma, you're telling yourself, how did I mess up this much? So you have to take care of your mental state, because when they give patients placebos, you feel like you're taking medication, but because certain persons need certain medication to make them feel like they are actually working on something. Sometimes even being happy, even accepting that this is what it is, I'm going to be on medication, not every day wallowing in, oh my God, I'm so sick, I have to take medication every day. So the mental state you should be able to, a patient should be able to, or the person who is treating should be able to take care of their mental, accept what has become, and tell yourself that this is the way forward, and accept it. Your response to both medication, doctors, you would agree, also your state of mind, it will affect how you eat, how cheerful you are, how you go about life, because before you know it, depression sets in. So it looks as if, whenever you come down with HIV, next thing you come down with is suicidal tendencies. They possibly don't go hand in glove, right? Maybe some medications might make you feel in a certain way. However, the mental disposition, and also, surround yourself with support groups. And I think that's something that we're not doing a lot in Nigeria.
Yeah.
Okay. There should be support groups for people who have certain, prolonged issues like this, so they will know that they're not the only ones, so there's a community of help, that comes around with this. And also, eating well, health, exercise, and feeding, take care of yourself. I mean, if you're immunocompromised, if I'm saying that right.
Yeah. Just having a general positive.
God. Give me a medical certificate already. That was smooth. Immunocompromised. So if you're immunocompromised, I feel like your diet should also be very important. I mean, you should be able to eat well, exercise, keep fit. Look at Dr. Tade looking all
buffed up and all.
I don't know about you, but you're on the way somewhere. So I mean, that's interesting. So to just recap on some of the things we said about prevention. It's important to know when you're aware, it will take you on to the next step. Okay, and protect yourself for male. And when we talk about protection, the woman just thinks that it's just the man. Just go and protect yourself and come to me. But a woman can just take a proactive measure to also protect themselves. The vaccines also, like you rightly said, I feel like everyone should get the HPV vaccine, get tested and get the vaccine. And whichever everybody, right, to get everybody should.
Yes.
Is it part of our NPI already? Is it part of it yet?
I don't think so.
Okay. Because in some countries, I know, but 111 countries,
not HPV.
Yeah, 111 countries have actually adopted it as part of their national, program on immunization.
Oh, really?
I don't know if Nigeria has.
Oh, okay, that's great. So which means male and female can take the HPV vaccine.
I don't know if Nigeria has.
Or HPV.
HP, human papilloma virus.
Male and female. I think it's more about female.
Female, yes, I know, because about the hepatitis B virus is the one that both sexes.
It's not part of the NPI yet.
Okay, so but I feel like everyone should get tested, and then whichever one that we can take vaccines for, we should take it. And then down to management, is important to go through the medication course, because there's even me seated here acting all moderator-ish. I mean, there are times when I feel like, okay, I feel better. Why do I have to continue? I mean, so there's a tendency to stop or drop out. So keep at it, because then again, when you start skipping, you start predisposing yourself to resist. Allow me say it. I mean, the words to antimicrobial resistance. Oh my God! Did I get it right? Antimicrobial.
That was nice.
That was nice.
Yeah,
tell me.
You need a certificate.
I nailed it. Thank you, guys.